Okay. Hello, everybody, and welcome to week number 10, the video lecture of the Ethics and Law in Psychology course. This is where we will be wrapping everything up and we'll uh, finish up the course here. So, I wanted to start this lecture by talking about, as is listed in the syllabus, this class will focus on termination issues, and then we'll also talk a little bit more. We'll talk about responding to an ethics complaint and subpoena and those sorts of uh, malpractice suit, those sorts of things. I may save that more for the class itself and talk here more about the ethics of termination. Uh, okay, so let's talk about termination. So, the issue of termination becomes a very important issue when we're thinking about ethics because what you cannot do is abandon a client. So you cannot leave someone without therapy uh, when you have started a professional relationship with them. So it becomes a major ethical concern that you not leave a client without treatment when you have started as their treatment provider. One thing I mentioned earlier that I wanted to stress here is I often make it a point of making it very clear when the therapeutic relationship has started. And to me, that's the first session. So I will try to limit as much as I can how much contact I have with an individual and how much time I spend talking with them before I meet with them for the first therapy session. To me, that's just an important thing to keep in mind because it limits the likelihood that there is going to be a misunderstanding about when you actually become the person's therapist. And so, if there are any difficulties beforehand with starting therapy sessions, if there's any disruption, any disruption in the schedule, or anything that interferes with you being able to meet with a patient for the first time, uh, there hasn't been a misunderstanding about when you become their therapist. That's why I think I've mentioned to you before that I um, don't have consultations, free consultations, as some therapists do with people beforehand. I will talk with them, but only to the point that it's necessary for them to help make the decision about whether they want to come work with me. And then if we do, I try to help make sure we save everything for the first session again. So there's not a misunderstanding about when the therapeutic relationship starts, and therefore there's not misunderstanding about when the therapy relationship is over. Um, so that, like I said, if before the first meeting something comes up and I'm not able to work with them, or they're not able to keep their first appointment, there's not that misunderstanding of whether I'm that person's therapist or not. To me, that doesn't start until the first therapy session. So that's just a little bit of a sort of insight as to when therapy starts. But the issue of termination, of course, is the opposite end. When does therapy end and how do you end it? I wanted to bring up some of the points that I thought were very important from the text. And some of them relate to this whole idea of notice. I guess what's important here is I keep referring to it as termination because that's often an issue that comes up as very important. But there's also, notice how the chapter is called termination and abandonment, meaning that the two are related because if you're ending therapy, you have to make it clear that you are not abandoning the client, that you're not leaving them without a therapist. And the bottom line of it is you cannot just say, I'm done working with you. Um, good luck. You have to make sure that you have given them some options. And just to walk you, we've talked about each of these scenarios, but just to sort of walk you through it, um, it is hoped and expected that if there is termination, because termination is a legitimate thing. Let's talk about termination first and foremost. Termination does not mean abandonment. Abandonment is an area of concern when you're terminating because you want to make it clear it's not abandonment. But termination itself does not mean abandonment. And it is certainly appropriate for therapy to end. In fact, you hope therapy ends. You hope at some point when you start working with someone, they make enough progress that uh, that you both are in agreement in saying, okay, therapy is now over. We have reached the uh, the end of therapy, and we don't need to meet uh, again. So the most appropriate, most above board, clearest way of terminating is you and a client agree that therapy is over, that the client has reached all of their goals, and there is no need for you to keep meeting. Now, let's walk through them. What are some scenarios where termination might, and of course, so if we take it back and say, well, how could therapy end when those things don't happen? And of course, the clearest is you and the client both agree. The other is termination that occurs on the client's end, and that's almost always up to the client. You know, they can't get in any trouble if they just decide they don't want to come in anymore. They may call you and say, um, you know what, I can't make this week's appointment. I'll call you to reschedule, and then they just never reschedule. One thing I wanted to bring up, well, two things I wanted to bring up regarding that issue in my practice, and it's certainly something to consider. One is I will just specifically ask people, I will ask patients to please not schedule a session unless they are sure that they plan to keep it. Um, I will try to set the stage as much as I can and make the environment one from the beginning where the client can feel comfortable to say, you know what, I'm not sure I need to come in anymore. Because I would rather they do that than schedule a session and just not um, keep it. Because my experience has been, and this is consistent with the research, is most of the time when a client just doesn't show for an appointment, it's because they've decided they don't really need any more sessions, but they didn't want to insult the therapist. They didn't want to make the therapist seem like they didn't want to see them anymore, or that the therapist wasn't helping them anymore. Now, it may be that they don't think the therapist was helping them more, but they didn't want to say that. And of course, I'm in private practice. Um, that's a big problem when that occurs for me because the appointment that they um, canceled, even if they gave me a day or two notice, was one that if I had more time, I would have known and could have filled it with someone else. You know, you have someone who cancels it even if the rule is they have to cancel within a day or 2 days, and they cancel 3 or 4 days, a lot of private practice, 3 or 4 days can even be a little bit cutting it too close before you can fill that to fill that slot back up. Maybe not. I mean, you might get someone to call and say, I need an appointment. You say, hey, I just had a cancellation. You would come in, 2 days from now. But but typically the rule is the more time you have, the easier it is to fill that slot. So I will just set the stage and ask them and say, um, do you want to um, uh, it, I will ask them, do you want to make another appointment? And I will stress from the beginning that it is much better for me if they just say no or I'll call you than to have make a session and then cancel. Now the other thing has to do, and this goes to the ethics of no show fees. Now I have a rule that everybody who comes in to my office signs that says that unless it's an emergency, if they cancel less than 24 hours before their scheduled appointment, I will bill them for the session. Now, because I have, in my opinion, that is ethical because I have it in the form that they sign. So I've made that clear to them up front. And I've sent people bills who haven't shown and they paid them. Um, Now, two things about that is one, what I'll be honest with, I haven't done lately, and I need to update this, and but other clinicians I know do this is anymore since I've done video therapy primarily. I always get a credit card because that's how people pay their copayment, and I don't have it in my authorization that that I will bill their credit card if they fail to show. So if they were to fail to show, I couldn't just automatically bill their credit card. I would have to contact them and let them know that I'm about to bill their credit card. Basically, I would say, "This is your no-show fee. Would you like to use the credit card that I have on file for you?" And they would just say yes or no. Um, Now, some clinicians I know uh, put that in the informed consent form. Doing that is allowed. It's ethical if you spell it out ahead of time. However, and I mentioned this before, some insurance companies will not allow you to do that. They will not allow you. Certainly can't bill them for a no-show, but they also will say that you cannot bill for a no-show fee. So you have to check with the insurance company. Some don't allow it. Some do. So, but clients can fail to show and not really face any repercussions for. They can just end the therapy relationship if they choose to. As psychologists, we on the other hand, though, have to take steps to make it clear that we are not abandoning the clients. We are not leaving them high and dry without treatment, uh, without options. So, in order to address what is most appropriate for terminal, I want to go through each of the scenarios. One is, as I brought up before, is the person loses their insurance coverage. So that you're seeing them for insurance, and they lose their insurance coverage. Now that, as far as making clear that you're not abandoning the client, would depend on um, uh, what happens next, because people, particularly these days, don't usually go from having insurance to having no insurance. They go from having insurance to having a different insurance. So the clearest way is they switch. They go from having insurance, and now they're on an insurance plan different from yours, or that you're not on. And in that case, the steps are pretty straightforward. You just tell them, um, "I am not on your plan, but your plan has a list of psychologists. You could call the uh, customer service number, member service number, on the back of your card, and they will give you a list of providers. If you want to see me, if you want to continue seeing me, that would be fine, but you would have to pay me my fee out of your pocket. Now, that's the most clear cut, in large part because you are not leaving the person without treatment options. They have treatment options. Um, you're just not one of them. Uh, now, for most psychologists, it's not um, a big deal. I will tell you one extra step I take if that happens to me is I will say, um, if you would like, get the list of providers and call me, um, and I will see if I know anybody. I'll tell you if I can recommend them, if I know anything about them, if I can find out anything about them. I can give you some feedback on who's a good provider or not. So I will give them an extra step. Um, but in my opinion, as long as you spell out for them what their next step would need to be in order to find the next therapist, um, you're consistent with the ethical guidelines because you're not leaving them high and dry. They have insurance. Um, they just um, you're just not on them now. Although making it clear that that is not abandonment does bring up this issue of when you find out about this makes it this sort of underscores the importance of making sure clients know that they should let you know as soon as they find out that there's going to be a change in their coverage. Because where that does become a little iffy is if you have this session and they tell you my insurance is changing tomorrow. Well, now you've just got that one session to actually terminate, to not just say, okay, well, that's it. You want to do whenever possible to bring therapy to some sort of close, even if it means, even if the person's going to go to a different therapist later, you want to bring your therapy to a close with them. So it's good if they can let you know. So you have usually someone, if they find out their insurance is changing, they've got a few weeks' notice. So you can offer them the opportunity to meet two, maybe three times to really wrap things up, depending on how long you've seen them. If you've only seen them for a couple sessions, then just having the one session to wrap everything up will probably be fine. But if you've seen them for a couple of years, you'll probably want two or three sessions to make sure that. So you want to try as much as possible to at least have some degree of wrapping up of the of the therapy, sort of bringing it to a close. Um, and how you do that really depends on your theoretical orientation. It really depends on how long you've seen the person and just how you do therapy. But it's good to have something that you can say that this was the termination process. This was the end of it. And typically I define that termination session as being the one where you sort of tie together everything you've talked about and sort of wrap up helping the person understand what they've learned from therapy, what they seem to have gained, and what they can do moving forward. Okay. Next scenario would be one where the person does go from having insurance to having no insurance. Now it's a little bit more um, difficult situation because um, there isn't just a list of providers that the person can see. You can't just say, call up your member service number and get the names of providers that they cover because there's no member service number. They don't have insurance. So in this case, you would I would recommend doing two things. One is you want to have access to any um, uh, community mental health centers, anything that is sort of this lower cost uh, option. That would include community mental health centers. Would also call it. It would also include universities that are nearby that have larger training programs, because usually the university, if they're training PhDs in clinical psychology, they will have a program where people could see the therapists in training for a lower cost because they're not fully licensed therapists. They're therapists working towards getting their license. But you want to have options available to clients who might lose their insurance. Now, what I would say you need to do is you need to work with the person first to see what the options would be in terms of them seeing you without insurance, and that would mean paying privately. Um, you would need to decide on, is there any way you could go, if they can't afford your set fee, are there any options as far as going lower? Can you put them on a payment plan? It's up to you. I mean, you have to, but I do think it's important to at least make it clear that you have gone through that process of at least discussing with them what all the options could be for them to see you privately. It does become a little tricky then, well, what if there just isn't, what if you can't reach an agreement about what they can afford to continue seeing privately? This is if they really want to keep seeing you. Um, and then I would say your role is to at least be available to them until they can get set up. And what I will tell clients is, okay, here are the places you can call if you're looking for a lower cost alternative. Um, I am still your therapist until you get an appointment in one of these places. I am still your therapist until you get set up there. But for now, um, uh, what I want, but for now, I want you to call these places and then let me know if you got set up for an appointment and when it is. So I will not schedule another appointment for them if there's no way that they're going to be able to pay me, but I will make sure they know that I am there for them until they have a new therapist in place. Now, I guess I will bring up here that most of the time that's not a problem. To be honest, very often when it is anything that the psychologist is uncomfortable with, it's more of an ego thing. Like, oh, I can't refer them to somebody else because who's going to be as good as I am for them? But most psychologists know you got to get over that. Of course, that's not the case. There are certainly other equally qualified uh, psychologists. I won't even say you have to say they're more qualified, but there certainly are equally qualified um, uh, therapists out there that the person could see, even those who don't charge as much to see as you do. So, very often it's just, if you get through that, if you get yourself in a comfort level, you can say, hey, I'm going to help you find somebody else. I just think it is always important, even if you're not scheduling another session, if you can't work out a payment agreement, that you make it clear that you are there for the person, to call if they have an emergency, even to set up an appointment if they have to have one. That you're there for an emergency. I don't think you have to set up an appointment with someone who's going to seek another therapist just sort of as a standard appointment. But I will say that I think you do have to sort of bite the bullet and see the person without them being the pay. If they are your client, they haven't found a new provider and they're in some sort of crisis. Uh, Other things to keep in mind about um, someone who maybe finds themselves without insurance is, especially since you're in a PhD program, and so hopefully will be at some point a PhD level practitioner. There are lower cost professionals. If you're a PhD level um, psychologists, licensed counselors will probably be charging less than you do. So that's another option. Um, Churches sometimes have their own community programs that so there are sometimes a lot of different options available, and you want to I would say a good idea is to just keep track of those things, like not having to worry about them until you need them is probably a good idea. It's probably good to get yourself as much information you can about what the lower cost alternatives might be out there. But again, keep in mind that until that person finds another therapist, you are still their therapist. You are still there. You can't just say you can't afford me. Um, uh, we're gonna, I just can't see you. You are their professional until they find someone else. I don't think, I know I said this on the score again. I don't think that you need to keep them on weekly therapy sessions if they can't afford to pay you. Um, but you do need to be available to them if they have a crisis or a real need to see someone and haven't yet been able to get set up with someone. That's just the nature of being someone's therapist. You don't get to just drop them, uh, even if you're working with them to find somebody else. That also relates to the other scenario for termination, which is what if you feel that you're just not able to. What if you basically just don't want to work with the person anymore? Now, you don't get to do just that. That, of course, would be silly. You don't just say, well, I don't like this person. I don't want to see him anymore. That's silly. Of course, you don't get to do that. But there are some legitimate um, ways that a therapist may feel that this therapeutic relationship just isn't working. If you just don't feel you're being effective, and that could happen for a lot of reasons. If you don't feel that you and the client are uh, connecting, you just don't feel like there's a good therapeutic relationship there. Um, Now, I brought up before that when you get in a situation where you just don't feel that you're ethically, I mean, you just don't feel like you're able to help someone, even if they want to keep working with you, it does present sort of an ethical bind because on one hand, there's the ethics of you can't abandon the client. On the others, there's this ethics of um, if you're getting paid for a service, it's a service you should feel that you should only provide a service that you think this person needs. If they're insisting it has to be you that they work with, but you don't feel you're being very helpful, then it's probably not a service that the person needs. So I think when you put it in those terms, it's an ethically more comfortable place to be, which is I'm not stopping the therapy because I don't like this client. I'm not stopping the therapy because I've got someone else who can pay more for the time slot or whatever. I am looking to terminate therapy because I just do not feel that I can be helpful. And I think in that case, if you're going to take that route, then you have to spend time with the client in a session, figuring out where you do think, what you do think could be helpful, how you do think, um, basically, what would they need to look for in someone who could be helpful for them? What is it you think is standing in the way, and how could that be overcome with a new therapist? So basically, helping them figure out what they should be, how they can find their next therapist if they do feel that they still need to be in therapy. Now, if you reach this point where you agree, you think therapy is over, you think the person has accomplished all their goals, and um, the person doesn't, um, then again, that becomes an ethical dilemma because you and if they're using insurance, it becomes another, there's an extra layer because you can't tell the insurance company, the insurance company is only going to pay you for sessions that are going to help the client. And if you truly don't think your therapy sessions are going to help the client, then you can't justify it to the insurance company. So I just think that if you reach that dilemma where you think therapy should end, as far as you seeing the client, but the client doesn't, then that needs to be something that you address in a therapy session. What is it that doesn't seem to be working here? Why is it you feel the person's uh, goals have been reached, but they don't? And what could the next step be? Um, Now, the added part is that the person who's using insurance, and I have done this with some clients, I've said, well, look, I know you feel that you want to get more out of therapy, even though we have evidence that we met all the goals you came in here with. Because of that, I cannot bill your insurance for this. So you would have to pay for it privately. And that usually ends it there. I mean, if you're telling the person that they're going to go from paying, you know, $25 copayment to, 125 or 150 or more out of pocket for a therapy session, that'll usually end it there. They may not be happy with what you're telling them, but it usually ends it there. So um, so it is, I think, I guess what I'm saying here is it's useful to keep in mind that a lot of times when you reach a point where you are thinking therapy is done and the client isn't, it's probably a therapeutic issue that needs to be addressed in a session. So, it's not something you can just throw at the client. You need to work through it with the client to try to establish, okay, well, why are we in two different places as far as how we're seeing therapy and the continued need for you to be in therapy? So, so those are all issues about termination, where you want to make it clear that you are looking to wrap therapy up, but you are not looking to abandon the client, or you're not doing things to even make it seem like you're abandoning um, uh, the client. Okay, I want to go through a couple of the key recommendations I have here, just to make sure we're not leaving loose ends as far as because a lot of different ways. Um, Client availability. I mean, sorry. Avoiding a client abandonment also means that you either have coverage for when you're on vacation, when you're not in the office, or you have some way that the client can reach you um, if you are on uh, if you're away from the office. So if uh, now if what you do is have a colleague cover for you, um, then you need to make sure that you have the client sign paperwork that says you can uh, that you can share information with that colleague. Now it depends. I will tell you that I stopped having a colleague cover for me when I went on vacation a few years ago, and just made sure I did have my cell phone and um, made sure clients could contact it. A couple of reasons I never go on vacation for any more than a week, which means that every one of my clients would at most be missing a week of therapy. And I've never had a client who said that they would prefer to see another therapist if all they're missing is a week. What they would prefer is just skip the week and see me in 2 weeks, even if they're typical on a weekly session. This is the last class meeting, so I should tell you, people have differing opinions with cell phone. I've never had a problem with giving out my cell phone number is my office number. So if someone calls me, they get my office, but if I'm not in the office, it goes to my cell phone. I've never had a problem with it, as far as people overusing. I've had, um, uh, if you're straightforward, like I'll be straightforward with the clients. I'll say, look, I'm going to go on vacation. Here is my number. If you need to get a hold of me, you can feel free to call me. I may not pick up immediately because I'll be on vacation, but you can call me. And I've never had a client um, abuse that. Sometimes it's a good therapeutic exercise. Maybe I've been meeting with them every week for a good while, and they've said, and maybe we're skipping a week and say, then maybe it's a good time to try it. Let's see what happens if you miss a week. Are you able to walk yourself through things? But it's totally up to you. I mean, like I said, I've only stopped having coverage because I'm never gone for more than a week. And like I said, I've never had someone say, I absolutely need you to, I absolutely need to see someone for a week. You know, I, if I can't skip a week, even if it means I got to go see somebody different. But if you do have coverage, and like now in that case, I also will document that I explained this to the person. We worked out what the rules are. We worked out what the crisis management plan was going to be. So if they just felt um, that they couldn't function, now again, remember I'm in a state where I can't admit someone to the hospital. So if they're so critical that they can't skip a week, they probably need to be in the hospital anyway, or at least be evaluated to go into the hospital. In that case, they agree to call the crisis number. Um, if you don't have coverage, if you just say people are going to contact you, I do. Um, uh, Other people I know, when they go on vacation, they'll have an answering service. Um, that's probably it. I actually used that up till just a little while ago, um, where I would have an answering service. So they would call. If they called the answering service would say, Dr. Marston's on vacation. Do you want us to call him or do you want to wait till you get back? And then they would have my numbers. So up until about 2 years ago, I used an answering service that was sort of the gatekeeper. And to be honest, I stopped using them because I just got so few phone calls, it wasn't even worth it. Um, so, uh, but for the most part, if you're not using a colleague to see people, it's probably uh, a good idea to have another option is to have an answering service who can contact you, who will take all the calls and then call you if it really is an emergency. Um, so those are all the different uh, um, those are all the different options. Have a colleague cover for you, have an answering service that can contact you in an emergency, or make sure the client has some way of contacting you directly. Um, those are three different options. The bottom line is you want to be able to document that you have not just left and the person has no idea what to do next. And then you also work out a crisis plan. If something does happen, here's what you do. Uh, but you have to make sure that they have some way of getting help if they need it, even if you're gone for a short period of time. One, I can't say it's enough. I've said this throughout the course. It continues to be a major issue that I want to stress, which is you got to document what you did. If you want to make the case that what you did wasn't abandonment, documenting what you did to make sure the client didn't feel abandoned is essential. So you want to document everything. Um, when you okay, and then this other one uh, is again one of the things here that they have even in the book is something I was just talking about, which is you want to make sure you process any issues that are impacting on termination or interfering with termination or where there's some degree of disagreement about termination. Um, you want to try, and you know what? I wouldn't even say try. I would say you cannot terminate with a client who's in crisis. Um, and when I said even about my own thing, like when I go on vacation. Um, it's just I've been in practice for a while and I've gotten pretty good at determining when someone's in a crisis. I would never leave a patient who I thought was in crisis or in danger of being crisis without taking those extra steps to make sure there's some way for them to get help. Um, Now, most of the clients I have, this is the other thing too about leave, is most of the clients I have who I think would be in crisis or close to being in crisis also have a psychiatrist. Um, I mean, that's the other part of my practice that may or may not be true of practices where you work is I have, I see a lot of clients who are also seeing a psychiatrist. So the person they would contact in an emergency anyway would be the psychiatrist. So, but you want to make sure that you cannot terminate with someone who is in crisis. You have to make sure that if they're in crisis or close to being in crisis, they have someone else to contact. Um, Now there, notice here that one of the things: do not continue treatment when clients are not benefiting from treatment, when you're no longer competent to help them, or when you objectively um, or when your objectivity or judgment is impaired. Um, I guess um, that last one would apply if you just feel that personally you don't like a client or personally they don't like you. Um, I don't know that I've ever seen or heard of that, but that would apply. I'm trying to think. I mean, of course you wouldn't. I mean, objectivity or judgment is impaired. I'm not quite sure where that would happen unless, just generally your objective, you have a head injury or you get really sick and you're, you know, not functioning at full capacity. But as far as objectivity or judgment in a specific client relationship, I guess if you just really are annoyed by a client, really don't feel that you can help them, um, I think you can't continue with them because you're not going to be able to help with them. But you got to work out some way that you can help them find somebody else, and you've got to talk them through, you know, what you're um, what you're going to do to help them find somebody else. You now, I guess if you just didn't like a client, uh, you couldn't say that as the reason. You have to say, look, I just don't think I'm the one who's going to be able to help you there, and I really want to help you uh, find someone better suited for you. So you kind of put it on you. It's like, I just do not feel like I'm helping you. I think we need to find you someone um, who is going to help you. Um, okay, and then this last part is to send. This is another thing about documentation. The idea that once you have wrapped up therapy with someone, if you, I do this sort of thing, this last one, consider following up termination. I do this with a phone call. Like I will ask a client, I will insist, I will tell a client, if I'm, if I'm giving them referrals to something else, um, they need to call me and let me know uh, what happened there so that I can document the And in fact, some insurance companies I work with actually require that. They say that if you refer them to somebody else, you need to check, either they call you or you call them to say, hey, this is what happened. This is what happened with that referral you gave me. And this is what I'm doing now, or to let you, or to just tell you, you know what, I know you gave me that person's name, but I'm going to wait and see what happens and just try without therapy for a while. But the letter is probably an even more better idea, where you say, hey, this is what we agreed to. These are the recommendations I made. Please call me and let me know how that went. Um, and if I can be of any other assistance, let me know. Um, as far as referring the client to someone else or terminating, unless it's just absolutely clear that you both are on the same page about terminating. It's always good to leave it with some sort of, you know, you can always call me if you need something else. Um, Always leave the door open. I think the best part about sending a letter is you can end it with saying, please call me if you need anything else. So you make it clear to them, I am leaving the door open for them to contact me. If they are choosing not to contact me, that is not my decision, it is their decision. Okay. You know what? I know you have a somewhat longer quiz this week. The quiz is a little bit more detailed. And I don't know, I guess we're about 15 minutes away from the end. So why don't we stop here and pick everything else up at the last class? If you have any questions or anything you need, just give me a call or send something in the discussion board. Okay. Take care, everyone. See you on Friday.